New results from the latest point-in-time count report in 2024 show that the number of people suffering from homelessness in the city of Lethbridge has risen 15% compared to 2022. Now, despite the rise, city officials say other programs and initiatives aimed at helping the vulnerable population are yielding positive results. Carson Marsouk reports.
Cameron Kissick with Streets Alive Mission has seen firsthand an increase in clients seeking supports and services over the years.
We're also seeing, higher volumes on the street as well, different demographics than we're used to dealing with. So we're seeing a bit of an increase.
The latest results of the 2024 point-in-time count show there were 522 people experiencing homelessness. That's up from 454 in 2022.
At first, glimpse, it would be nice to see that number showing a negative increase, that we'd actually be improving our situation as it relates to homelessness in our community. But I do think there's some promising underlying stats there.
The report says 92 people were staying in emergency shelter, 274 were unsheltered, 64 were staying in transitional housing, and 82 individuals were in institutional settings. Indigenous people accounted for 68% of those who disclosed their racial identity. The majority of individuals were male and between the ages of 25 and 44. Although 81% of those counted had used emergency shelter in the past year, many reported avoiding them due to safety concerns and overcrowding. While the total is up, the report shows that the rate of increase has slowed significantly. The average growth rate between 2018 and 2022 was 19.5%, whereas between 2022 and 2024 the rate dropped to 7.1%.
Hopeful that some of the things that we've put in place over the last 3 to 5 years are now starting to have an effect on that number.
Malcolm says supports and programs like the encampment strategy are making a difference.
We often think of things like shelter and the supports for the individuals that are experiencing homelessness in our community today. But I think we need to acknowledge that there are pressures across the whole continuum, from affordable to supportive to even market housing.
The city says since it brought in outreach services in-house, there have been a 263% increase in outreach intakes and a 318% increase in referrals.
Rather than just housing or just mental health supports or just treatment, addictions treatment, or just having them run concurrently with each other so that you're able to offer more of a well-rounded support.
Carson Marsouk, CTV News, Lethbridge.